Medical necessity may be the most important healthcare term nobody ever explains, yet it influences hospital admissions, observation status, tests, treatments, insurance decisions, and even denials. So what exactly does medical necessity mean? Many people think medical necessity simply means I'm sick, but that's not quite the whole story. In simple terms, medical necessity means that the care being provided is appropriate for the patient's care and requires that level of care at that time. For example, you may have an infection. One patient may be treated successfully with antibiotics by mouth. Another patient may require IV antibiotics and closer monitoring in the hospital. Both patients have an infection, but they may require different levels of care. In other words, it's not just about whether you're sick. It's about what type of care you actually need. Remember this, the diagnosis is important, but the diagnosis alone does not determine the level of care. This is where many people become confused. The question is often not, is the patient sick? The question is, what level of care is medically necessary for this patient at this time? That's an important difference. So understanding medical necessity helps explain many of the questions we've already discussed in previous videos. Why wasn't I admitted? Why was I observation instead of inpatient? Why was my neighbor admitted when I wasn't? Medical necessity is often at the center of those decisions. But understanding medical necessity raises another important question. If medical necessity determines so many healthcare decisions, who actually decides? Your doctor? The hospital? Medicare? The insurance company? We'll talk about that in the next video. Was medical necessity ever explained to you during a hospital stay or insurance review? Tell me about your experience in the comments. And if you're trying to better understand how healthcare decisions are made, subscribe and join the conversation.